People come from all over the world to taste French wine, and the locals would certainly say it's the best on offer. But when does a harmless drink before dinner become a harmful addiction? This week we're taking a look at the curse of alcoholism and efforts to curb its impact. Coming up this week. A pill to cure alcoholism passes a vital test. We speak to the existing users of the drug baclofen, who are already convinced of its remarkable effects. Next, they've never had a drink, but they'll be scarred for life. South Africa has the highest rate of children disabled because of mothers who drank heavily during pregnancy. And finally, alcoholism booms in dry Pakistan. We visit one of the growing number of rehab clinics treating patients in a country where alcohol is banned. There's no indication anywhere on the packaging that this pill could well be the 21st century's greatest tool to overcome alcoholism. Baclofen was originally designed to treat muscle spasms, but has gradually developed a following among heavy drinkers who swear by its ability to cure their addiction. To date, scientific evidence has been sketchy, but the drug has just passed a vital early test, paving the way for formal, funded clinical trials. It's a small price to pay for this recovering alcoholic. 6 pills costing less than €1 per day. Enough to curb a craving that could have well ruined her life.
I started at 10 milligrams, then 30, 50, etc., until I reached 110 milligrams. At that point, I realized I no longer had a desire to drink.
Sylvie Umbernell leads an association of former drinkers who've had somewhat miraculous results with the drug baclofen. No more obsessions with alcohol. It can even play an ordinary role in her life.
I drink, but I'm not dependent. The baclofen gets rid of the dependence.
This idea is at the centre of a bold study making waves after this paper was published in March. Professor Philippe Jury is among the lead researchers, and Hervé Christen, one of more than 100 patients whose evidence has played a crucial role.
Do you still feel the need to drink?
During the day, not at all. It's more at night when I go out.
Hervé says alcohol was just like a fiancé. At his worst, 2 bottles of whiskey per day, along with a dozen beers. He was heavily dependent for more than a decade, of which 8 years he was unable to work. Today, he has a job.
I tried everything, every medication that exists. Detox treatments, post-detox, abstinence, the number is countless. All of these for 12 years, and the only thing that really helped me escape alcoholism and the addiction completely, and I mean in less than a year, was baclofen.
Professor Jury's study showed the drug is effective in as many as 60% of cases. Baclofen, he says, works by suppressing the impulse to drink.
There are 2 types of impulse. There's the impulse before, that's the one when we're not drinking but we feel the need to. And then there's the impulse during, which is when we've started drinking and we can't stop. They're different, but baclofen blocks them both.
One theory is that alcoholism is linked to a deficiency in an acid known as GHB, which acts as the body's natural relaxant when it stimulates receptors in the brain known as GABA. When there's a shortage, alcohol can fill the gap and people progressively become dependent. But baclofen can also act on these same receptors, making us feel relaxed without a drink. The French authorities have so far been cautious. Now the state has just allocated €750,000 towards formal clinical trials, starting in May.
We're not here to say we're in favor or not in favor. We're neither anti-baclofen or pro-baclofen. We don't know entirely the benefits of this drug. We haven't sufficiently evaluated its effectiveness or its side effect at relatively high doses.
The drug could help more than 140 million people dependent on alcohol around the world. One problem is that baclofen is a generic, with a cost of around €3 a box, not enough to attract financial investment. Professor Bernard Granger is one doctor who takes risks by prescribing the drug for alcohol addiction, despite it not being authorised. He recognises baclofen isn't for everyone. Side effects include both severe drowsiness and insomnia, but the benefits outweigh the risks.
There is no major danger. For example, there hasn't been a single reported death attributed to an overdose of baclofen. It's less dangerous than aspirin.
Baclofen could be officially approved for alcoholism by 2014. In the meantime, research is also focused on whether the drug can be used for other addictions, such as those associated with bulimia, sex, and the use of cocaine. The image really says it all, pregnant or not. You may have noticed this warning on wine bottles advising all soon-to-be mothers against drinking alcohol. It's been mandatory here in France since the government was accused of not alerting women to the risks. Unfortunately, though, the message hasn't made its way to South Africa, where binge drinking during pregnancy is common, and it's the children who are paying the price. This next report from Cape Town.
The cow sleeps, so we know it's that one.
Tisha is almost 16 years old. She struggles with schoolwork and can't remember simple tasks. She's one of thousands of children in South Africa born with learning difficulties because her mother drank during pregnancy.
I can write my name, but I can't write my surname.
Vivian and Peter adopted Tisha as a baby, helping her cope with the problems caused by fetal alcohol syndrome.
So read the sentence again.
Her learning disabilities are that she cannot read or write. She can't do simple mathematics. She's got no idea of time.
South Africa has the highest rate of fetal alcohol syndrome in the world. It causes brain damage and stunts growth. Professor Dennis Villian has been researching rural communities in the Cape, where some 10% of babies are born with the condition.
It's the most common birth defect. On its own, it amounts to all the other birth defects, serious birth defects that are found in South Africa.
Police blame much of the drinking on illegal bars known as shebeens, which sell alcohol without a licence. But for these women in Guguletu Township near Cape Town, the problems go much deeper. They blame poverty and a lack of education. Louise drank while she was pregnant with her daughter Tiona because she didn't realise how harmful it could be. Now she wonders if that's why her daughter is small for her age and slow to learn maths.
It was a drinking because she was a fake was drunk. She was a fake was drunk.
Tisha doesn't know her real mother, so she'll never be able to ask why she drank. She, like so many other children, just has to live with her disabilities caused entirely by drink.
If there's one place in Paris that you won't find alcohol, it's here in the Great Mosque of Paris. There's many countries around the world that also forbid alcohol, similarly for religious reasons. Pakistan, for example, has been dry since 1977, but the law is widely ignored, and now the predominantly Muslim country is experiencing a growing rate of alcoholism. This next report from France 24's correspondents in Pakistan.
Every Thursday, Dr. Sadagat Ali hosts a public health show on Pakistani television.
There are 1 million alcoholics in Pakistan.
Speaking openly about alcoholism in this fiercely Muslim country would have been unimaginable 10 years ago.
It's no more a taboo. Now media is quite vocal about it, and we don't face any social stigmas or any kind of resistance from society.
The taboo may be broken in the media, yet to this day, not a single public hospital offers treatment for alcohol addiction. Patients must rely instead on expensive private clinics. 30 years ago, Dr. Sadakat Ali opened the first rehabilitation center in Pakistan. Today, there are 4 in the country.
It is very unfortunate that drinking is most popular in Pakistan amongst the elite class. People are afraid of being stigmatized because of going into treatment, not because they are alcoholic, because if they go into treatment, they feel stigmatized.
Relatives fear the public embarrassment of having an alcoholic in the family. They are usually the ones who get in touch with the center. For 6 weeks, they're trained by psychiatrists on ways to convince their loved ones to seek help.
Alcoholism is like a big thing. It's like a flaw on a person. It's like a black spot on you, on you and the family also. You know, they think, oh, they're bad people. Don't even meet them.
Faika's husband has been sober for 3 years. For 9 months, they came to the clinic together every day. They now take part in group therapies 3 times a week, in addition to private consultations.
You are not a victim. You can change in your life as and when you want. They do not have to suffer alone in their endeavor towards success. They can take help from other people.
Waqar is proud to have overcome alcoholism. This architect in his 60s confesses he lived by the bottle for 30 years.
It's always been there. People have been drinking ever since Pakistan was made. But it was all, kind of under the carpet.
Only a handful of restaurants catering to foreigners are allowed to sell alcohol in Pakistan. The law forbidding Muslims from buying or selling it dates back to 1977. But the black market has provided a steady flow ever since.
Of course, alcohol is not inherently bad, and 1 or 2 glasses each day is seen as perfectly acceptable. Although the World Health Organization does recommend that we have at least 1 alcohol-free day each week. Thanks for joining us here on France 24. We look forward to seeing you, as always, next time.